I'd like to ask the Minister for Health and Social Care if she will make a statement on the anticipated benefits and outcomes that will result from the reorganisation at Ramsey and District Cottage Hospital.
On the Minister to reply, Mr Beecroft.
Thank you, Mr President. As announced on the 2nd of November 2017, a new all-island intermediate care service to bridge the gap between the care that is provided in hospital and people's homes will be launched in February 2018. The expanded step-up, step-down 31-bed inpatient service for those with moderate care needs will also serve to reduce the current pressure on acute beds experienced at Nobles Hospital. The 31 beds at Ramsey and District Cottage Hospital represents an increase of 10 beds compared to the 21 currently available and is a significant investment. The beds will be available to all island residents. Instead of being admitted to Nobles Hospital, older people with medical problems will be able to step up from home to the new unit in Ramsey if their condition requires it. This should further help reduce admissions to Nobles Hospital, 999 calls and emergency department attendances. The service will be led by a consultant doctor specialising in medicine for older people who will be supported by an additional speciality doctor. This new approach will bring significant benefits, as one would expect with a consultant-led service, including intermediate and dedicated access to specialist clinical expertise. The consultant will work closely with colleagues who care for older people in the community, such as residential care staff, GPs and district nurses, meaning that these professionals will have more readily available specialist medical advice when managing those patients with complex age-related healthcare needs. This additional expertise means that more people will be able to have treatment at home, benefit from quicker and more appropriate care, and avoid potentially unnecessary admissions to Nobles Hospital. Discharges from Nobles Hospital should also be faster, as patients who meet the criteria will be able to step down to the new unit in Ramsey as their condition improves, with support and rehabilitation available before they return home. It means that Nobles Hospital will focus on delivering only the most complex and specialist healthcare on the island. This investment demonstrates the Department of Health and Social Care's commitment to Ramsey and District Cottage Hospital and illustrates its vital and ongoing role as a national asset for the benefit of our whole community.
Supplementary, Mr Hooper.
Thank you, Mr President. I'd like to thank the Minister for that quite comprehensive answer. The only follow-up I've got really is how will these outcomes that she's just talked about be measured and how will they be communicated to the public?
Minister? I'm sorry, Mr President, I didn't hear the beginning of that question over a sneeze. I beg your pardon. Could I ask the questioner to repeat it for me?
The question was how will these outcomes be measured and how will that be communicated to the public?
Sorry, how will the outcome be measured? The outcome of patients? Sorry, I'm still a bit slightly confused with what the question is asking.
The Minister, in her original answer, talked about faster discharge times from Nobles, a reduction in the use of Nobles beds, things like that. How will that be measured and will that be attributable to the expanded service at Ramsey? And if it is, how will that be communicated out to the public?
Minister.
Thank you, Mr President. We're very keen to have everything measured and benchmarked and reported on, and that will all be available. It will be on the waiting times, etc., and the turnover times. That will all be available as we go forward, putting more and more things on the website that will be available to the public.